I'll be telling you what occupation are there for physiotherapy. Breaking down, we have different type of occupation. I'll just read through. We have pediatrics physiotherapy. We have pediatrics. Basically, we are dealing with kids. You understand? Kids are there growing up. There are many cases of kids when they are born. They used to have something like CTEV. You might not know the term CTEV. All right, CTEV. We're talking about deformities of the ankle joints, basically. All right, some deformities are there, congenital deformities, a lot of them are there. So there is a big scope for pediatric physiotherapy to come into play. We have something called geriatric physiotherapy. This is for adults patients who are aged above so let's say 60 years upward or 50 years upward. Our grandparents, that are our parents, right? So they need physiotherapy for daily exercise so that they will be fit, so that they will live more longer. Some people, when they are aged and they are not having enough exercise, then they will fall into chances of having issues with their cardiac and etc. So that is why geriatric physiotherapy is very important. All right, and we have mental health physiotherapy. I'm doing my master's right now. I still take some courses of psychology, all right, for mental health. We do something called sports psychology, all right. So it's very important for your psychology for you to relieve your depression, but it depends on what field you want to specialize in. We have orthopedics. The orthopedics are very essential, the most essential ones, all right. Orthopedics, most times you have fracture in your hand, you have issues with your body, so you go to the doctor and the doctor have to see you, and those are the orthopedics to help you correct that issue. Apart from orthopedics, we have the sports physical therapy, and you're talking to one right now. You're watching one right now. If you're watching from your screen, I'm in sports physical therapy, and what we do, there's a lot of opportunities in the sports world out there, like football players, like cricket players, like tennis players, like basketball, etc. A lot of sports are out there. What they need me. They need me to travel with them all the time, tell them how they have to eat, how they have to train, how they have to treat themselves. All these things I do them in the sports field. We are a lot, all right, not only me. So physiotherapy has a very big scope, all right. Apart from sports, we have occupational health. Occupational health, like people, like let's say your parents who works in the office, all right, they need physiotherapy to tell them your back will ache you, you have to use ergonomics. Your hand, you're using your hand on your table, you remember there's something called tennis elbow, so that you won't have issues. You have to mind the way you keep your hand placement on the table. Apart from that, we have something called the clinical electrophysiology, all right. That is using electric modalities, that is improved physiotherapy, where we use electric modalities for treatment and other stuff. We have neurology, very important one. Most people who are suffering from stroke, most people who are suffering from Parkinson disease, like your parents might be having these issues of Parkinson, you're shaking, like something like that. Most people who are suffering from cerebral palsy, like kids, especially most have the chances of cerebral palsy, so they need physiotherapy. We, the physiotherapy, we have to work on them. We have another cardio-pulmonary therapy. We're talking about pulmonary therapy. These people are very, very essential, especially most people who are having their asthma attack. You're having issues with bronchial issues, like let's say tuberculosis. Most of these sickness, the cardiac therapy are the ones who are responsible to help you recover from these stages. So cardiac therapy. And if you're having heart issues, most people who are suffering from heart attack, after doctors have examined you, let's say for example you have somebody who had heart attack before, okay, good, after doctor examining the person, doctor will say you're good to go, take medicines, go. But physiotherapy have to train you and condition you to adapt so that your heart will not go back to what it was before. So that is why physiotherapy is very important. Then we have intensive care physiotherapy. All right. Most of us, like I'm a graduate of physiotherapy. All right. I can do all these works, but though I just specialize on sports. All right. So most physiotherapy, if you have a degree in physiotherapy, you have all the ideas of these fields. All right. We have the next one, OPD's physiotherapy. I used to do OPD's physiotherapy too. All right, women's health physiotherapy. Let's talk about times of delivery. You need a physiotherapy. Your wife needs physiotherapy if she's pregnant, for exercise and etc. So physiotherapy is so important in that field. We have stroke choices, stroke service. I spoke about neurology, physiotherapy just now. So we have all this physiotherapy field, guys. So physiotherapy has a very big field and very big opportunity. Forgetting to mention army physiotherapy is still there. So army, most patients who are army military personnel, they need physiotherapy for their day-to-day life activities. Click my next video to watch more things about physiotherapy.